document.
Hi, I'm Emily. I'm the student nurse, and I will be doing a neurologic and eye skills examination on you today. Before we get started, can I please have your name and date of birth?
Robert Jenkins, June 23rd, 1982.
Perfect. I'll go ahead and just give us some privacy here. Okay. And before we get started, there's just some questions I need to go over with you. Do you wear glasses or contacts?
No.
Any changes in your vision recently?
No.
Any new physical changes that you're concerned with?
No.
Okay. And I'm just going to assess your alertness and orientation. So what date is it today?
March 20th, 2021.
And where are you right now?
Your condo.
And who is the President of the United States?
Joseph Biden.
Okay. Awesome. So now I'm going to go ahead and assess your 12 cranial nerves. So I'm going to start with cranial nerve 1, which is olfactory. So I'm just going to have you hold one of your right ear for me. And I'm going to have you close your eyes. And I'm going to have you just tell me what you smell.
Vanilla.
Perfect. I'm going to have you hold the other ear. Keep your eyes closed.
Cinnamon.
Okay. Perfect. So olfactory, cranial nerve 1, intact. So now, intact bilaterally. Now I'm going to go ahead and examine your eyes. So I am going to inspect your eyelids for symmetry, checking for any lesions, drainage, crusting, and eyelash distribution. So eyelashes and eyebrows equal hair distribution bilaterally. Eyelids are symmetrical without lesions, drainage, or crusting. And I'm just going to assess your sclera. I'm just going to use this for that. I'm just going to assess your sclera. So sclera is white. It's white bilaterally. And now I'm going to just check the conjunctiva, which is pink and moist bilaterally. So now I'm going to check your optic nerve. I'm going to be checking your vision. So I'm going to have you just hold one eye for me. And I'm going to have you read line 8.
D-E-F-P-O-T-E-C.
All right, now cover the other eye for me. And I'll have you do that backwards.
C-E-T-O-P-F-E-D.
All right, now blink a few times. Now I'll have you do it with both eyes.
D-E-F-P-O-T-E-C.
Okay, perfect. So cranial nerve 2 intact. So OD 2020, OS 2020, OU 2020. Intact visual fields. Now I'm going to go ahead and check your cranial nerve 3, 4, and 6, and these will all be tested together. So first I'm going to go ahead and start with oculomotor nerve. So I'm going to assess your pupils for equality, shape, and reactivity to light through direct and consensual responses using a pen light or ophthalmoscope. So I'm going to be checking for size, shape, direct reflex, consensual reflex, and accommodation. We're going to check your pupils first. Okay. I'm going to check the other side, sorry. Okay, so pupils are equal, round, reactive to light, and accommodation. Perla. Positive corneal light reflex bilaterally. Now I'm going to go ahead and assess, so that was the cranial nerve number 3. And cranial nerve 4 and 6 go hand in hand together, so trochlear nerve and abducens nerve. So I'm going to just, let me see. Okay, so I'm just going to have you follow my pen. Just look at my pen. And you're just going to follow the direction of my pen, okay? So look at my pen. I'm just going to be doing this shape of an H here. So extraocular movement intact, no signs of nystagmus, and positive convergence. So now I'm going to check my right hand, the right eye. The patient's, so your right eye with my right hand. I'm checking your left eye. Okay. Left eye, looking at your right eye. Okay. Sorry, I know that's really rough. Okay. So positive red reflex bilaterally, and that is the end of those 3 cranial nerves, so cranial 3, 4, and 6. So now I'm going to go ahead and go right to trigeminal nerve, which is 5, which is cranial nerve 5. And I'm going to go ahead and assess light and sharp sensations on 3 spots on your face. So I just want you to feel. So this is soft, and then this is sharp. Okay. So you're gonna let me know what one is touching your face, okay?
Sharp. Sharp. Soft. Sharp. Sharp.
Yes. Okay. All right. So sensory nerve and trigeminal nerve intact. I'm going to go ahead and palpate your TMJ. So I'm just going to put my hand underneath your chin and have you open your mouth for me, your jaw. Close. Open your mouth for me. Close. Open your mouth. Okay, close. Okay. All right. So TMJ. Positive. So I was able to palpate the TMJ bilaterally. So now I'm going to go ahead and do 7. Cranial nerve 7, which is facial nerve. So patient deferred sweet and salty taste, but I'm going to assess your smile, cheek puffs, and eyebrows. So I'm going to have you just smile for me and puff your cheeks and raise your eyebrows. Okay. So that is so cranial nerve 7, facial nerve intact. Now I'm going to go ahead and check your acoustic nerve. So I'm going to have you just cover your right ear for me. Yep. And I'm going to go over here. And I'm going to whisper something, and you're going to tell me what it is, okay?
Okay. Spring.
Okay, awesome. I'm going to have you cover your other ear.
Summer.
Okay, awesome. Okay, so acoustic nerve intact. Now I'm going to go ahead and check the glossopharyngeal nerve. So deferred sweet and salty taste, but I'm going to have you swallow some water. And then as soon as you swallow this water, I'm just going to have you say your name right afterwards. Or say ah.
Robert.
Okay. I'm just going to have you swallow and say ah.
Ah.
Okay. So glossopharyngeal nerve intact. Which was number 9. So vagus nerve, which is cranial nerve number 10. Now I'm going to have you swallow and then say your name right after.
Robert.
Okay, perfect. So vagus nerve is going to be intact. Would elicit a gag reflex, but that's going to be deferred. And I'm going to go ahead and check the spinal accessory nerve. So I'm going to have you just shrug your shoulders up for me and down. Put them up again and down. Okay, awesome. And I'm just going to have you push to the side. Okay, and then push to the side. To the left. Okay. So spinal accessory nerve intact. So I'm going to go ahead and check the hypoglossal nerve, which is 12. So I'm going to have you stick your tongue straight out for me. Okay. And I'm going to have you move that tongue from side to side. Okay. So intact facial sensation, face symmetric with strength equal bilaterally, intact hearing bilaterally, symmetric rise and fall of the soft palate and uvula, in positive range of motion of the tongue. So hypoglossal nerve intact. So now I'm going to go ahead and check the deep tendon reflexes. So first I'm going to check your tricep. So yeah, let me just feel back here. Okay, so your tricep on your right side. Relax, relax, relax. Feel that?
Yes.
Okay. Now I'm going to check your other side. Nope, nope. The tricep. Feel that?
Absolutely.
Okay. So tricep. So it's +2 bilateral. Now I'll check your biceps. I'm actually going to have you pull your sleeve up for me. Yeah. So I'm going to put my finger right here. You feel that?
Yes.
Okay. Okay. So the bicep, deep tendon reflexes, +2 bilateral. Now I'm going to check the brachioradialis, which is going to be in the arm here, on the radial side. Relax your arm.
I feel it.
Okay. Okay. So that is brachioradialis +2 bilateral. Now I'm going to check your patellar. It's going to be right underneath right by your knee. Okay. Sorry. Okay. Do you feel that?
Yes.
Okay. So that is patellar +2 bilateral. I'm going to get your Achilles. Yep. So rest your foot here. Well, actually there. Yeah. Okay. Let's your other foot. Yeah, flex your dorsalis. Your dorsal. Okay. All right. So that is Achilles +2 so reflexes +2 bilaterally, with the exception of no. You felt all of them.
Mm-hmm.
Okay. So now I'm going to check your motor and coordination. So I'm going to assess your upper extremities. I'm going to assess your arm strength bilaterally. So I'm going to have you just grab my hands and squeeze them as hard as you can. Okay. I'm going to have you pull and push. Okay. Awesome. So, all right. So now I'm going to have you pretend like you're holding a box of pizza box, and I'm going to have you close your eyes for me. Okay. You put your hands down. All right. So, upper extremity strength 5 by 5 bilaterally, and negative for any drifting. Now I'm going to assess your rapid coordination. I'm going to have you like this as fast as you can with your hands. Okay, awesome. That's good. And then I'm going to have you rapidly alternate. So I'm going to have you touch your nose, and you're going to touch my finger with your hand as fast as you can. Make sure you touch my finger.
Okay.
So go ahead. With my finger. Okay, good. All right, so fine motor movement intact bilaterally, positive rapid coordination. So I'm gonna assess your gait. So I'm gonna have you come right over here. I'm gonna have you walk, yeah, you're just gonna walk toward me. Well, I can't, okay, just walk over here. Okay. So now I'm gonna have you turn around and I'm gonna have you, I know, well, they probably need to see. So let me see. I'm gonna have you walk from heel to toe. Okay. All right. All right. So fluid smooth gait, positive tandem walk. And now I'm going to have you actually stand up again. Sorry. I'm going to have you stay right there. Put your hands by your side. I'm actually going to come here to support you and shut your eyes for me. Okay. You can open yours. All right. So that is a negative Romberg's. And that will be the end of our assessment. And I actually forgot to ask you at the beginning, is it okay that I had you on video for this? Okay, so thank you very much. And that is the end of my video.